everyone. I'll make this nice, sweet, and simple for y'all. I don't think it's anything spectacular for me because I've been doing this for a while, but I know the feeling of getting things digitized, automated in your office to make things simple. It's a blessing, and it's really wonderful to have that. So maybe I take that for granted. So this was my presentation actually to home office last year, prior to everything getting COVID, everything getting canceled out. So this was my presentation called Back to the Computer. So I hope you guys enjoy it. My little Back to the Future theme. So this was a best practice that I became a finalist for. This is my little mug, or what is it, my tumbler, for being a finalist. So what is our best practice? We made our client service agreement forms, or for everyone else, it's called your ISP forms, and our nursing forms paperless and automated. Results were we saved over 300 hours a year. Estimated cost of savings was 10,000 a year, and we made work less stressful and more efficient. Now it's time for the story of how we came about with this. So time. Excuse me. Time is a valuable thing. We have a lot of it, and some wish they had more of it. To a business person, time is money. Entrepreneurs say it's the most valuable thing they have. Time is essential to this best practice. So we need to jump back into time to fully grasp what we've done. The best way to navigate around time would be in a time machine like the 1980s cinema classic, Back to the Future. So here's our little time machine. Okay, so we need to jump back in time to fully understand that. Let's get ready. Time machine, let's go back to October 19th, 2018. The year is 2018. Our Disney Angels office, like most, is running its business with paper forms coupled with data entry on scheduling software, AxisCare. So we're going to show you our client enrollment process. So this is what it looked like prior to our changes. So I would get a lead call. We'd probably spend 30 minutes, put some data entry on there, handle the phone call, find out what their needs were, and then I would come out and meet with them. To travel there, because I have a little bit, good sized area, it's about a 30-mile radius. So estimated it could be 45 minutes is the longest I'd probably drive out somewhere. Then we would handle the assessment with the client. That's about an hour and 15 minutes. If there are talkers, if I'm really quick, I can get there in 30 minutes. It just depends on the scenarios, what I'm faced with when I go to the house. And then we have to travel back to the office, followed by we have to put the data entry in. And then we also have to scan and file all documents per state required rules and regulations in the state of Georgia. I'm sure every state has some rules similar to it where you have to keep everything on a file. So the total time was about 4 hours, 15 minutes in this entire process. Now, where does this lead us? This leaves us with the client fully entered AxisCare, and now we're ready for scheduling. Again, this is total time. Even in between, I might handle phone calls while I'm driving, but again, that's the process it takes to get a client enrolled. Now, inspiration can come from many places. Doc Brown envisioned how to invent the flex capacitor after bumping his head, thus making time travel possible. At this time, we find me being inspired through email. The email was from the home office about best practice finalist. It was from my franchisee classmate, Rochelle Coffey in Somerville, South Carolina. And this was a great practice I found on the ARC, going paperless with DocuSign. So we quickly applied her methods to improve recruitment orientation process, which did indeed help. We even tried to apply our client enrollment process. We mapped out everything to see what we do, every person's task, and unfortunately concluded it didn't significantly improve our process since it would only have saved a few minutes on scanning documents. In short, what it really means is I would take my paperwork, I would have to input all the data points again, save the PDF, scan it off, print it off, then have to scan it and print it again and put it in everything. It just wasn't really as efficient as doing everything on paper, which I wish I could do with my client enrollment paperwork. So now let's travel back a few months later. Time machine, let's go to May 1st, 2019. Year's 2019. We're still running our business with majority paper forms, other than the ones we used on DocuSign for hiring. So time travel relies on a heavy amount of energy, 1.21 gigawatts to be precise. Home care also needs strong software. So AxisCare offers features. In 2017, they launched the Form Creator tool. Many of the forms could sync information about clients to other pages on their account. So this is a feature they have, all of you guys know about. As we discovered the signature option, On the form creator tool, we realized we could now make our client forms paperless and automated the information on those forms. It was like a jolt in the, sorry, you need to get out, buddy. That's my kid, guys.
Thank you for recording this. That will be the best.
Soccer star. Anyways, we're gonna get back to our story, right?
No, that's my little girl.
So we're gonna go back to see how how we went back to the computer. So time machine, let's go to our present date, March 3rd, 2020. So now our Busy Angels is running its business with majority forms paperless and automated. Now, keep in mind, this was my presentation last year. So we're still using all these practices, which I'm gonna kind of go into details. So here's our current client enrollment process. The enrollment process looks like this. First, we get the call, nothing's changed. Then we travel the client's home, nothing's changed. Now we do the assessment and enroll client with data entry. So in other words, when I'm with a client, I will pull out my iPad or my phone. A lot of times I'll use the iPad just to kind of give a brief example. I'll have it with them and I can either type it on the forms or I can do it with my thumbs like a cell phone. But I found a way to doing that while I'm meeting with the client. Nothing's changed. Now, what's different is I don't have to travel back to the office to get the paperwork in. And when I'm in there typing everything in on these paperless forms, the client is now fully entered in AxisCare and ready for scheduling. So total time is 2 hours and 30 minutes for this whole enrollment process, saving us an hour 45 minutes. And the breakdown obviously is an estimate around $10,000 in cost. It's estimating, a director's salary, and then you take the hourly. You guys can see the formula right there to figure out how we got to this annual savings. It's just about saving time in your process and getting clients enrolled. I have seen with, last month, I had a client, I got enrolled, we got all the paperwork forms in there. I put their calendar in literally as I'm talking to them within maybe 30 minutes. Before I walk out the door, my team's calling them saying, Mr. or Mrs. Jones, just be safe because I'm not sure which one it was. They said, this is so-and-so from our office. We have a caregiver scheduled before I left the door. Again, that's the power of this process. So with more time on our hands, it leads us to be more productive and less stressful, thus enjoying our work. So anyways, yep, that's part of the presentation. The rest is history. And we plan to take our paperless and automated journey beyond what we already have accomplished. So where we're going, there are no roads. So I know by the way. So we applied this also to our nurses' forms. We've applied this best practice to our nursing forms. These include Georgia State required nurses assessment form and the service plan form. Also, we have a supervisory visit form. We've created multiple forms. I'm a nerd about this stuff, but so the results were for the nurses, we saved over 380 hours per year, and we get immediate results on client records. So what's pretty cool is during our last presentation, not to be rude on my part, but I had to confirm some items on our payroll notes. And all I did is I looked at all my nurses' forms and I checked as we were waiting. Okay, my nurse went here. I need to go look at this form. I see a signature. Yep, timestamp, we're done. I added to my payroll notes. And now my nurse, we just verified all of her visits because we made all of her forms also on AxisCare and we digitized those. So again, you can apply to so many elements of your business. Anyways, this is, sorry if I went back. That's what the old forms look like. And that's what the new forms, if you can really see it on the computer screen or the television screen. And there was this demo that allowed us to play.
Here's a demonstration on how the form creator works.
Just by way of asking everyone, have you guys ever played with the form creator or seen how it's in use?
Yeah, I tried, but I didn't have time.
The time machine.
I know the time machine, right? Would it be beneficial, Craig, for this video, or I can just kind of explain what it looks like?
I would actually love to see you log on to your AxisCare and show everybody, because I think a lot of people would benefit from seeing these forms. Jacob? You've automated everything from the application to the onboarding to the training videos and for when they're being trained as well.
Yep. Excuse me. So here's what, let me see if there's any more. I'm just going to skip over here. Okay. Let's see. I think definitely a live presentation will be beneficial. Let's see if I have to do anything here. These are just kind of the elements you need to have. And I think when I was presenting this, you have to understand I'm presenting to all the Visiting Angels offices, or at least the ones that were at that business builder event. And this is how you can implement this in your office. We all are doing the same thing. A lot of us have tablets, iPads. We are using, I'm assuming everyone here uses AxisCare. So we have all the tools you need to actually go paperless. And we'll have reliable data services as well. So my takeaway on the whole project was any time-saving efforts are worth it. There is a learning curve to creating forms, but after you figure it out, it's pretty easy to use. So what is it? AxisCare is the only software. Oh yeah, as far as I know, it's the only tool that allows us to have this form creator, at least in the element of automating it to all forms are all account information on AxisCare. And there's still limitations with it, but that's what it is. Okay, so I'll go to a live. Can you guys still see my screen here?
Yes.
Okay, let's see. Oh, I think it took me out of here. Let me go into my AxisCare. And I'll just pull up, what is it, a lead that I have. Okay, I'll show you live clients right here. Okay, let me see. Bear with me, I'm gonna try to share my screen. Okay. Okay, everyone's able to see that now? Okay. So I'm gonna give you an example. So if I'm meeting with a lead and I'm coming with someone, obviously I go to the lead page and I'm talking with them. This is sensitive information right here. So I have it. You go to the forms tab, and then I can create a new form. The one forms I created is to Texas, is the ISP, but in Athens, sorry, in Georgia, it has to be called a client service agreement. The first thing I actually do when I meet with the clients is I'm gonna ask them if I can have them sign off our privacy forms or our HIPAA waiver form. Just like at any doctor's office, everyone understands it, has no problem. This one, which I can send to everyone, is the actual corporate Visiting Angels notice of HIPAA privacy practices form. I just put it all in AxisCare to save you guys time. So it just talks about their federal rights as patients. It has all this information right here. We don't go over this, by the way. I just say it's our HIPAA privacy forms. You see, I'm the officer right here, and then also you have my contact information. I go in here, I type in their name. What is it? What's it? Let's say Mr. And then right here, I have, you can use your mouse, or I have my finger on my tablet. You can sign wherever you want. And you notice everything's time, date, and stamped. So any questions about that? Yep.
Which finger do you use?
Yeah. Do you type in this data, or the form's uploaded?
It's already been uploaded. I prepared the form already in advance. So all they have to do is sign. And when I get to this part, I will have to type in their name. You can have it automated, but I come to find that you never know if it's the care recipient that can sign off, or if it's their family member, power of attorney, or a loved one, or a friend. So whoever.
Or I'm sorry to cut you off. So like if I have like a PDF, I'm very intrigued by this right now. If I have a PDF of like all my forms, that New Jersey's kind of crazy with a lot of forms, I can just upload them into AxisCare and then have like a little sign off type thing.
Nope, this one. Oh, sorry.
Yeah, I was just saying you have to recreate the form.
Okay.
AxisCare will let you scan it and then have it automatically pop up. You literally have to go in there and build a form. At least if you notice where, I mean, this is a silly thing, but you see how this is indented over here, and then this is bold, and there's a space. All of that right there is from the editing feature of it. I put this paragraph by paragraph. You can get your whole form. It's gonna look bland and ugly. It's just gonna be all the documents. I try to make it look closer to what corporate had. And that's where you mess around with it. You can really create the form. Anybody can create them at all. It just takes time to learn how the features work and such. And I'll show you how to build them. But this is what it looks like. So they'll sign off on this. And while I'm with them, and this is hard to show right here, I'll click on the print feature. And then I'll go to print. And normally I do this on my iPad. Right now, you guys are looking at my screen, which is a Surface Pro. And what I'll have is, you know, if you ever print off documents, you have the option of sending your printer wherever you want to. I would print it and save it as a PDF. On my iPad, it allows me to have a button to pick. It's that, you know, that share button, it's like the square and the arrows pointing up. I click on that, it pops down a whole list of how I can share it. And I do it through my Busy Angels email. So I email them this form literally within like seconds from after having them sign off on it. So I don't need it'll still be on the forms on AxisCare, but now the client has a copy of it because I emailed it to him in real time. And that leads into the next thing that's important is get rid of mailing your invoices to clients. You want to email everything. Emails can be efficient, faster to deal with. And this kind of gives them a reason to say, okay, we'll do email because I'll email them copies. But my backup is if I can't do it, I'll go on AxisCare, send a message to my team that this is so-and-so. We need to print off the form, mail it to their address. So my team's handling it while I'm talking with them.
When you say you go into AxisCare and tell your team, do you do it under call log and just tag your team?
Well, call log's great. It can get saturated. No, I want to make a record that this came for this client. So here's what I would do. You can see, or I'm going to leave this because I'm not going to say that form. If I go right here to profile, you go to anywhere where you can type in a note. You can sync it in. So I'll go under lead notes, say new client. Can you guys see me typing this?
Yes.
New client. Sorry, I normally would tell my team, welcome our newest client. They are great, and some more information, right? And then all I will do is just like the call log, you click on your users. Here's my two girls I use. Avis is my staffing coordinator, and I have Sherry right here. And you click send a message, and it gets emailed to them and sent to them immediately. And they see, and I also, oh yeah, forgot I need to tag it if there's a category. It could be, you know, update, whatever it is.
Thank you.
Okay, I'm sorry, did that answer your question?
Yes, thank you.
And I can do that literally while I'm talking to the client, no problem on my iPad. There's no issue with that. So I'm literally messaging them through AxisCare, getting my team to know what's going on. Okay. So let me go back to my next form, which is a little bit more cumbersome. I'm sure you guys have more questions about it. That's the ISP, or for Georgia again, the CSA. So I go over here, and you can modify it however you want, but I try to make this as close to the ISPs that we all have, obviously being compliant with Georgia. So I go in there, I can click on this drop down, the date. So if I see somebody today, I'll put May 4th, 2021. Automatically, you know, right here, their name populates, their address populates, everything populates, so you don't have to re-enter everything else. Again, that's the beauty, is you automate things with these forms. So less you have to do, less work. You put in their date of birth. Whenever I put the date of birth, this category right here, I'm inputting this data points, will go to everywhere in AxisCare. Just to show show this. Here, I'm gonna leave this form. Here's the client, no date of birth, right? If I go back to the form. Go to date of birth. I'm sure you guys will believe it. Let's say they're born January 3rd, 56, right? I'll save the form. Now it's been saved successfully. If you go to their profile, you're gonna notice their profile's been updated. And you don't have to do multiple data entry points because you do it all once while you're putting your notes in. So I'll walk them through the form. Typically, what it would look like is I would get their name. Prior to this, hopefully, I'd like to get their responsible parties or emergency contacts, the relationship. I like to put the doctor's name. If I can't do that, I'll put in like hospice or whoever referred us if there's somebody's medical provider. One of the key things here that this will save only here. Let's not, this one can't be shared. And that is, this is part of Georgia. I have to write the description of services as stated by the client. Then you have other categories like, okay, for Georgia, we have to identify if it's personal care, which is hands-on services, or companion sitter services. And, you know, you have these, oops, that's not it. You have these drop downs. Oh, that is this, I'm trying to automatically fill it. Yeah. You have like a whole drop down list of items you can pick. Normally I do this on my tablet, but right here, you guys probably have this also on your ISPs, your fee and accurate billing policy. Does that sound about right to everyone?
Yes.
Yep. Go right here. I'm putting my finger on my screen, you know, what is it? You know, JB, you know, for Jacob, right? For Jacob Buffington. So here you go. Time date stamp. Go initial. Yeah, it's going to be chicken scratch, but you know, this is what they'll do. Now, and I tell them in advance, you're going to have 3 initials, 4 signatures. You know, if they're sounding like, oh, that's a lot, I'm like, you know what, I can't control it. That's what the state legislation has set in Georgia. We just have to be compliant. So I go through these forms. I've had a few people who want to read through everyone, and we'll take the time to let them go through it. But these are, you know, essential forms. We have the client automobile release of liability. That is our, you know, the automobile release of liability we have in Georgia. You'll check a box. That's it. Have them sign off, move on. You can put in, if they wish, you go automatic bank draft, use of personal funds. You know, we don't like people really handling funds if they don't need to shop for them. So a lot of times they deny permission to use it. Again, they'll sign off however they like. And then I'll type in the name of whoever is doing it. Sorry, my computer has it automatically saved to put my personal data. But again, I do this on my my iPad, so that doesn't pop up. We have our rate sheet for our area. So there's a breakdown of services. And then I go to the payment consent form. Paul Womack sent out to us, you know, a couple things that we should have. I gave it a title called the payment consent form, unless that's what he already gave and I'm just taking credit for what he already did. But I find this is very helpful. We'll put our client class. So are they going to privately pay? A lot of times it's always going to be an ABD. So they're automatically bank drafts. And I think I went over this earlier. I don't think it was like a day or two ago, or was it yesterday with Derek?
Derek's not in here, but
Oh, anyways,
Big Derek.
I show them this. So what's going to carry over is when I click my client class, my billing department will now know what class they are when I save it. And then right here, what does carry over is this is on the billing tab, the billing notes. So I will say it's ABD, and I'll put the transit. Oops. And I'll type the number 1, 3, 4, 5, whatever the number is, in the account. And you know, whatever number it is. And one of the key features, because some of these forms are automated, is I will type in the billing email. If I put the email in, now when I convert them as a client, it's going to state what email address is going to go to. The billing department from Syntax now knows this is where we email them. If not, then we also have them sign off on that. And then the last part is the consent form. We'll have this person sign here, or responsible party, type in their name, sign there. If not, I actually made it a little drop down for me where I just put my name automatically and I sign off. If not, you can have it typed in. But that is our client service agreement form. Again, whatever I do here, I'll discard this. Well, let's say you save it. You can, again, go to print option, and I can send this to them in real time. And this is all done while I'm with the client. And now the beauty of it is now my team, I have these forms. So let's say I go here, they're converted as a client. If I go to the forms, I can have these options. I can save the forms as is. I can edit them whenever I want, or I could even print them, that is, save them as a PDF and upload them on their documents. So it's like, you know, hard copies saved. We can print them off in our office and have them on the files. But yeah, this is, sorry, it's vanilla, really boring stuff here, but that is one form. Let me go to a client. Let me show the nurse's side. Melissa, does anyone have any questions about this before I jump ahead?
Yeah, quick question. This is heavy, by the way. But does it transfer over the potential calendar or schedule that they're requesting?
No, that one, I wish it did, but what it will do is on the, when you have them converted as a client, actually on our nurses forms, whatever you change on AxisCare will pop up on forms to the nurses and put in the schedule.
Okay.
So you can change things on it from the nurses form, which I'll show you one, I'll just pull up a client of mine. You can go to, let's see, this is a client of ours. If I go to my forms right here, so you can see like we have all these forms filled out with her. If we want to, this was the service plan. If I click on the service plan, this is one of the 2 forms our nurse have to fill out. It has my nurse's name. It talks about, if there's a delay. Right here, you see the calendar. This is her calendar. Her calendar is constantly changing. So whatever this, for us, it just allows us to automatically have that inputted. I wish I could put that in there. There are some limitations, but we just put that in there. We type in the what you saw in the ISP form, that calendar, that one I just put in like 4 hours, 2 hours, whatever we think the schedule is. Sometimes people don't know their schedules, and I'll just leave it blank and fill it out later if I need to. But those aren't connected. They're not automated. So here is, the ADLs that we also input. Those aren't automated. We have to manually type those in. That stinks. That's a little bit of data entry, but right there, the ADLs right here, whatever we typed in the office converts over. So my nurse can either change them or they automatically generate in her forms. And this is all for her notes, medications. And here's my nurse signed off on here. And she signed off on October 20th, signed off on July 15th, signed off on January 25th, and just May 4th. What's the great thing about this? I have a nurse that I would always see, and I love seeing my nurse, but I haven't seen her in probably since the pandemic happened, because she's 66 years old, 67, was worried about COVID, but guess what? She was able to, take care of all these forms to the clients and have them all done in real time. So that's just one form. You want to see our nurse's assessment form. This is what our nurse has to do when they assess the client when we first start. At least in Georgia, we're required to have a nurse's assessment. All these items right here are all right here. We can save them, print them off. Yep. Any questions? I guess, do you guys have questions about this? It's really, I know it's really boring stuff, but it's nice when it saves you time and you get all these forms done in one place. And I don't have to, scrap through my paperwork. I can always pull up what's going on.
Can I ask a quick question?
Yes.
So, does your nurse ever notice that the client needs more care? Does she ever help increase hours? I'm just curious.
Yes, she will reach out to our office or email me, or call me a lot of times, and she'll report about the client. Hey, this is so-and-so, this is what's happening. I think we need more care. And we try to get that feedback from not only our nurse, but also our caregivers. And that allows us to call the family and have an opportunity to try to increase hours. We did that with a client last week, of a client who was he was a cancer patient and he just got on hospice. Unfortunately, because of our staff shortages, we weren't able to get him staffing, and they found another agency. But we were able to have the call by people reporting back to us to let us know there's an opportunity right there.
How often are your supervisory visits?
In the state of Georgia, it's supposed to be every 90 days. And if not that, we do it every 120 days. So either 3 or 4 months, depends on the type of care.
Thank you.
So, Jacob, what's the latest date on the most recent? Because I know when I saw this end of last year when I was with you, what is this called if people want to, if I want to kind of share this with the crowd?
Yeah, this, so here's one of the things. Let me show you actually how you build forms. If you guys haven't ever tried it before, I'm assuming a lot of you probably have, or have tested it around. You just go to your admin, go to forms, and this is going to show you a whole list of all the forms that are available. And it allows you the feature to share your forms. So here's all the forms I have. Some were generated by AxisCare. They just weren't a good fit for us. We had to make our own. So here is, so if you guys wanted the HIPAA form, which by the way, that's supposed to be required by every office. Is everyone doing that, by the way? Is sharing like the HIPAA privacy practice forms?
No.
We're about to.
I had a corporate come to my office about like a year or so ago. When I showed them this, that's when they told me to present this as a best practice. But they gave me the forms and they're like, well, this is the form we want you to use. So I just uploaded and I typed it in that night. But this form right here, if I want you guys to have copies of it, see right here on the screen, that is the sharing code. I can share you this code so none of you have to type it in. Now you guys have it. So I'm going to do this one. I'm going to copy that and I can put it, I think, in the chat feature. So that way people can just copy it. Now, if you want to share a form, I did this with Eric yesterday, I believe. What you can do is click new forms and you go import and it should allow you to type it in. Oh, this won't allow me to type in. Great. So you would paste it, and when you import it, you're going to get a copy of that form. I don't know if it'll let me import the one I made.
Hold on, leave it up there.
Okay, hold on. I'll show you guys. Let me do this. Can I get the chat feature on here? Chat. I'm going to share you my code. Let's go. There's the code. You see it, Craig? Okay, so you guys have the code. You don't have to type it in. Just input that. Oh yeah, this is important.
Yeah, we got it. Okay, we got it.
I don't expect you guys to remember this, but
Got it. Yeah.
here's what you remember. When you get the form, because I learned this with Eric.
Okay. We're on our way.
When you get the form, you need to go over to, when you receive it, you need to go to, what is it? The permissions, because this is the thing about these forms. Only certain people can create them and manage them. You don't want everyone in your office or too many cooks in the kitchen. So you're gonna have to click on here and you can type in a group. So mine should have director, can edit, or, and then you can also put in your name, which accounts you have. So you're gonna want to put all these in there as permissions, and then you're apply permissions. Because when you do that and you save it, now you can go to, hold on, sorry, you can go to your form creator. Let's say we go back here to that example. Now you can click on it and I'll show you what it should look like. Because when I gave it to Derek, it didn't look like this. And him and I were FaceTiming. So when you click on here, if you look to your left, that's what you should see. It'll tell you the width of what you're typing in, the spacing, and then here's all the text content. You can change this out many times you want. There's some editing features. Again, none of you guys have to worry about this because I just gave you the code for it. But whatever forms you have, if you like the form, you can share it. The payment repayment program, the employee repayment program. Here, I can show you guys that form if you want it. Where is it? Employee repayment form or agreement. Here's what I have. I type in my name, I put the amount and the reason, put the caregiver's name. Well, actually, this is automatically populate because when you build forms, you can actually identify if the form should go to like a client or a caregiver or office staff. So when you go on forms, like when I'm with a client, I can pull this up. Sorry, not with a client. This employee repayment agreement form can only go to a caregiver or a staff member. It cannot go to a client. So it won't pop up in their forms when you're on their account. Does that make sense? Sorry, can you guys hear me?
Yes. Yeah.
We're just all in awe.
Sorry, I shouldn't rush. Again, I feel like this is boring stuff, but I'm sure this is really good information for y'all. Again, yeah.
So Jacob, can you put up the code again?
Yeah. Oh, you want the code for the repayment one?
Well, for I guess for the services agreement one. Client
Sure,
services
I'll give you
agreement.
mine. Mine's designed for Georgia. Keep in mind,
Right,
when you get it and you change the editor, you can go ahead and take out the Georgia stuff and change it to El Paso or change it to wherever you like.
right.
Okay, I'll send this code for y'all. You can retitle the form too. Let's see. Client service agreement. Here we go.
Which one did you get? The CSA. There's like so many different forms of CSA.
Here we go. You see it?
Here, so you have that.
I'm gonna copy this and put it on the chat again. I'll at least send it to Craig.
Okay, we've always still wanted
He's
that.
gonna, I sent it out to you. Cool.
And what's cool about the HIPAA form is it's the same everywhere.
Yeah.
Standardized
Yep.
throughout. Good.
On the HIPAA.org website or HIPAA.gov, you can actually generate the form yourself.
Okay.
You enter your office's name, the address, they'll print out with your letterhead on it and everything. And what we did was just scanned it as part of the intake packet.
I mean, yeah, you can do that. The only thing I thought was beneficial in this case was, so you can get any PDF forms, you can use DocuSign. The thing that's beneficial here is when you have the form there and they sign off on it, it's already in AxisCare. And so if I
And they don't have
Hmm?
they don't have it to take with them. It's not their form. That's the issue.
What do you mean? Oh, they don't.
They call back in to see their rights. So like having the form in AxisCare is great, but not giving them a copy is not great.
No, that's why you email them a copy. That's what I do. I email it to them right then and there.
So by HIPAA regulation, though, you don't have to leave them with one, and it's law. You don't. Sorry,
That's arguable.
well, it's not, because I implemented in a
Oh,
hospital, but
okay.
by law, they can, if they ask you for one, you have to give them one. But you do not have to automatically give them one. You ask them to sign one, and would you like a copy of that? If they say yes, then you do have to provide it. But if they say no, then you're covered.
I like Joe's stuff.
In the implementation of it in 2000.
And to go a step further about HIPAA, if you go to the Health and Human Services website, they actually identify who are covered entities. So for example, your doctor's office, you can't share somebody's medical information. But if you're in the military or a school, you can. They're not protected. Technically, home care like Busy Angels home care practices are not a covered entity. But state legislators and a lot of organizations, including Busy Angels Corporate, they're just trying to be safe and then sorry. So we always should act on the side of caution.
Right, exactly right.
Sorry, did I break out?
No, we got you. Good.
But no, that's a good point though, what he brought up, which is it's not cool that they can't have a copy. That's the benefit of making sure you hit the print option. Would it be helpful if I show my tablet, or all I would do is I would go to the print feature, like like on my tablet where I print like a wireless printer. I print it and I change the option. Instead of hitting print, I'm able to pull to my Busy Angels Gmail account and I see the PDF right there and I email it to them. And now they're on my email history and we can do everything electronically for invoices or anything.
Some state auditors will prefer that you have it in your packet that you leave with them, but they're also going to prefer and try to make you have all of your emergency preparedness, your contact list, your 211, a copy of your signed agreement, and things of that sort. You can mail all of that stuff to them, or you can leave a folder with part of those things in. It just depends on what your state certification is.
This is an Illinois thing, is why.
HIPAA, that's a federal regulation, and federally, you can offer them, and it's compliant.
Well, but state, like for example, I'm in Illinois. There's only two of us, I think, in Illinois here. But the Illinois state licensure requirement is that your ISP has HIPAA attached to it. So when that's the case, it trumps federal. My understanding is local law always trumps federal. I mean, otherwise, why is marijuana legal in Illinois now? Federal law says no, marijuana is illegal. State law says yes, it is. Dispensaries are everywhere.
But if you look at long-term care, the long-term care facility is federally funded. You cannot have marijuana in a federally funded.
That's right. Federal trumps. It's just that if the state allows that, that's fine, unless a federal agent comes in and says, I don't care what you think, federal law trumps. So
what I
if we
do
were
also,
better regulated, even in a Medicare world, the offer of it is all that has to happen.
Illinois flex is way too much then, because they act like it's required.
Hey, I went to grad school in South Fraser, Indiana, so I was moved to Chicago. There's a lot of problems in Illinois, I can tell you that.
What do you say?
A lot of problems in all.
But
Well,
I
I appreciate your honesty.
Visit in Illinois.
How about you live there for 47 years, then you can talk.
Not like my father-in-law. So
Everyone's still doing the COVID screening daily?
Oh, yeah.
Yes.
Oh, yeah.
I mean, probably you should, yeah, especially with the new Texas something that went out a
It's
couple months
still
ago.
required by Texas.
Y'all do it through your forms as well?
I do it through care.
This is AxisCare, right? How you clock in and out?
Care vision, sure they don't have.
Yeah, that's right.
It still states that you have to wear a mask, you have to do surgical mask.
What's that, N95?
No, just a surgical.
Awesome.
So no cloth.
Hey, this is good stuff. Thank you for sharing all this. There might be follow-up questions later this week. Thanks for sharing the forms that you created. We appreciate it.
And please apologize to your son from us.
I told him I'm gonna be in a meeting, so I said, hey, you gotta calm down and not make any noise. But here he goes asking me a question. It's all good. I have too many.
My wife just actually